I mean, I have to say, so from your resume, impressive resume, by the way. Considering that you're helping people with housing and things like that, such like you're cultivating whole neighborhoods and what impacts so many different families, and then you go to a more individualistic approach. I was wondering maybe you could talk a bit about that, just out of my own curiosity. What made you
Yeah.
want to go away from helping whole areas to focusing on individuals?
Yeah, I think yes, on one hand, sometimes doing individual therapy can sort of feel like um, you're not necessarily like targeting, because the whole thing with social work, right? And the whole belief is, we are a person in our environment, right? Like if we don't have our basic needs met, it's going to be really hard to go ahead and ask someone to do cognitive behavioral therapy, right? Challenge your thoughts if you don't have a place to sleep at night, right? So it's kind of like, hey, we do have to kind of get people's basic needs met and then take it from there. So, I think I did learn a lot. There's also, a lot of red tape as well when you're working with things county related. So, there are some roadblocks that can be disheartening when trying to get services. And, not that I would ever say that I gave up on that because it was hard. It was, I don't know, I felt like I, personally for me, I did realize that when I was doing a lot more of like the case management stuff, we would inevitably kind of, also since it's correlated, talk about feelings, right? Talk about ways to, even in, let's say, new housing, right? There's so many emotions that come with that. It's not just black and white that someone gets, housing and then everything's great. And, I think there's a lot of misconceptions as well, where, I don't know, I feel like, for example, if I'm getting housing or working on housing for someone who is homeless, there's just a lot of barriers for that to first actually happen. It takes so much time. And then on top of that, let's say someone does get housing, there are a lot of stipulations that come with that. And it can be overwhelming, especially if you're dealing with mental illness. So, I think for me, I wanted to kind of work in both realms. So, yes, I'm working on the macro level, understanding that emotions are, of course, intertwined with our basic needs. But I think personally for me, I feel that um, I really do like to get that individual one-on-one time, whether it's weekly or bi-weekly or monthly or whatnot, to really get to know my clients. And I think sometimes it was hard to do both because it's very much just like getting all the paperwork done. So in some ways, I think having both under my belt has been good because it just gives me different experiences to bond and to connect with people.
Yeah, that's what I'm saying. It's quite incredible because you can understand on so many different facets and so many different levels of how a person is suffering and what they're going through and everything, right? The only way I can kind of relate to what your perspective is I do understand what you mean when currently, like I work in the like in academia. So when I'm taking care of a lot of students, it was very front heavy, almost kind of like a revolving door, get them in, help them out as fast as you can, get them out. But these are humans, right? When they came in, they're suffering. They need assistance immediately, and like you're saying, it's very disheartening when you're trying to get you know what they need, but the red
Right,
tape
right,
comes in, right? And it's like, oh man, it's gonna take some time to help them. So when I started focusing more on just like individual students, you can really get to the core of these issues and really discuss these things. And so I really understand in that part, like how it's more, it feels a lot better at the end of the day that you're able to be more involved in a client and how to help them as opposed to leaving it up to the mercy of whoever it is that it needs to take care of that specific need. So yeah, it's pretty
right,
cool. I can
right.
If you want to hear more stories, don't forget to subscribe, comment, and like. To support more youth by youth led projects, visit us at youthspeak.ca where you can donate and spread youth mental health awareness.
YouthSpeak Performance Charity. Speak, inspire, change.